Hello, my name is Stelly Rekus. I'm a bariatric surgeon in Bradenton, Florida, and today we're going to talk a little bit about educating our patients on something that's very important, and that's really abnormal eating behaviors. So today we're going to talk a little bit about why we eat, different kind of reasons that can get us into trouble with eating. We're going to talk about emotional eating, food addiction, setting goals, and how to counteract some of the problems that we face. So again, I like to break up things into different topics. The first topic we're going to talk about is really going to be emotional eating. So, when we talk about emotional eating, that is really a mechanism that we can use as um, people essentially to make yourself feel better when you eat. So, ultimately, when you're feeling bad, you're having a bad day, there's a lot of signals that your brain gives to you when you eat, specifically when you have glucose levels, when you eat something sweet. The blood's dependent on glucose for energy. So when you have a high amount of glucose that goes to your brain, it can make you feel good. So the problem is really avoiding this emotional eating and listening to your body and listening to your stomach, not to eat just to make yourself feel good, but essentially we have to train our brains to really eat when we're hungry and to change the way we think about food from a way of saying, hey, I'm eating to make myself feel good, or I'm eating to nourish my body so I can become healthy. Um, the other thing to talk about is when you do emotionally eat, it really doesn't fix any emotional problems. In fact, after someone eats what we say an emotional eating, you have sense of issues with guilt, because after that sugar high is gone, essentially what happens is your glucose levels drop, your emotional issues are still there. You had a temporary fix with that eating. So a lot of what we do is to try to re-educate patients to listen and eat with their stomachs and their bodies and not with their brain. So again, how can you tell if you're an emotional eater? Well, there's telltale signs. Do you eat more when you're feeling stressed? Does anxiety drive your hunger? Um, when you're not hungry or when you're full, do you eat? Do you eat to calm or soothe yourself? Again, do you reward yourself with food? And do you continue to eat after your body has told you that you are full? And other things that we can look at is how is your relationship with food? Does food make you feel safe? Do you look at food as kind of a friend or a comfort? And do you feel powerless or out of control around food where you just don't have the willpower? So these are all 10 telltale signs that you could be eating emotionally, and that's something that we really want to steer away from. So there is a cycle when we talk about emotional eating, and really this starts off with something bad happening. Some triggers out there, whether it causes fear, anxiety, panic. Um, Patients develop this urge to eat, and they overeat. They eat more than they should, and they eat the wrong kinds of things. And after that initial kind of um, feeling of satisfaction or high glucose levels, and then the guilt and the powerless issues over the food come into play. So this is really a cycle, and at the end of that, you feel bad, and then you want to feel good again because there is that temporary satisfaction that you get when you eat. So again, one of the things that we talk about a lot is distinguishing emotional hunger from physical hunger. Okay, and the difference is really this: an emotional hunger can be triggered from a certain situation. It comes on quickly, whereas physical hunger comes on gradually. It's your body's way of saying, hey, I need nutrition. um, Emotional hunger feels like it has to really be fixed immediately, whereas physical hunger can take a little longer to be satisfied. uh, Emotional hunger also tends to trigger certain types of foods that are high in glucose. Things that are going to hit your bloodstream quickly and give you that sugar rush. Whereas physical hunger can give you multiple options to eat. Um, and really, if you listen to your body, it'll tell you what to do. But again, there's a big hard stop between listening to your brain and listening to your stomach. And again, emotional hunger is not fulfilled when your stomach is full or after a meal, whereas physical hunger stops after you have become full. And after you eat emotionally, there are triggers of guilt and powerlessness and shame. Whereas when you eat when you listen to your body and sustain that physical hunger, well, you don't have those senses of feeling bad, um, which is what we want to work towards. So again, important thing to do is identifying a problem. What are the triggers for emotional eaters? Stress, um, anger, fear, sadness, anxiety, loneliness, resentment, and shame. These are emotions that can trigger patients to go into an emotional eating state. Feeling bored, feeling empty, um, also continuing childhood habits that started early on, and also social influences. We really want to tell our patients that when you're eating, look around. Most people are doing it the wrong way. Most people are eating too much, too fast. So again, we no longer eat to sustain our brain and to feel good. We're eating to sustain our whole body and improve our overall health. So what can you do when you're an emotional eater? How do you get out of this cycle? Well, really, first you have to do is you have to identify that you do have tendencies to eat emotionally. And once you can identify that problem, you can work on it. Taking time, really, you set a pause before you eat, before you give into a craving. Ask yourself, why am I eating? Am I hungry? Am I eating just because of a certain time? Am I eating because something happened? Or am I eating because my body's telling me that I need nutrition to sustain myself? If I'm feeling depressed and down, well, what are my alternatives to eating? Who is my support? Do I have someone I can call? Do I have some other task I can do? Can I go for a walk? Can I do something that's not going to be a detriment to my health instead of just eating? And really having those connections, whether it's a close friend, a family member, having someone to go to when you're feeling bad, is very important to avoiding continuing these cycles of just eating whenever you're hungry, or eating whenever your brain tells you that you need glucose. So again, you have to sustain your hunger and making sure that that hunger is coming from your body and not from your emotional state. Again, if you are someone that's prone to anxiety, you have to learn how to not just identify that anxiety, but offer an alternative. And that can be going for a walk, meditation exercises. There's a lot of deep breathing exercises. So really you just want to identify where you're at, and if you're having an issue with your emotional state, slow it down. Don't just turn to food, and look for alternatives. And whether that's walking, going for a bike ride, meditating, turning the lights off, laying down for 5 minutes, something that can be an alternative for you. And again, if you're tired, if you're exhausted, um, make some tea, take a bath, listen to some music, do an alternative. There's so many other things that you can do that are preferable to eating poorly because you want to get out of this cycle. And again, if you're bored, you don't just want to feed yourself when you're not hungry. Go outside, change your habits, break that routine that you might be stuck in. So again, you want to practice what we call mindful eating, and that's really knowing exactly what's going into your body, why you're putting it in your body, and what the value is of that into your body. So you don't want to be doing things at the wrong time. So when you're eating, when you're doing other things like watching TV, driving, playing with your friends, playing on your phone, watching videos, you're not really focusing on eating. You're just going through the motion. So again, you no longer want to eat except for the reason to sustain and nourish your body. So we're not eating emotionally, we're not eating when we're not being mindful of it. It's really, you get to determine now what you're going to put in your body and what the time is for that. Um, so again, when you focus on really taking control of when you eat and what you eat, it's a very empowering thing and it helps you break that cycle. So the question is, how can you now focus on, hey, planning meals is super important for this topic, because when you know exactly what you're going to eat 1, 2, 3 days ahead of time, it eliminates a lot of the old habits. The other thing to talk about is not having poor choices around you. If you don't buy it, then you can't eat it. So again, this is a technique that you really have to implement every day, and really focusing on just practicing that you're going to control what goes in your body. So food addiction, like any other addiction, is a very interesting topic. And as people, you can say that we're all somewhat addicted to food, because if we don't eat, then we die. But we want to change that addiction into a nourishment. Okay, so we don't want to become addicted to that sugar high, and we really want to just avoid abusing things, because anything outside of moderation can turn into addiction. And when food becomes an issue, um, getting too many calories, eating the wrong things, going after that rush of high sugar, then addiction can comes into play. And especially we call it an addiction is when that habit, no matter how good it is initially, is done in excess, can lead to an interference in our patient's quality of life. So food addiction really is something that should be addressed with a medical provider. And there's so many options out there, including psychologists, psychiatrists, support groups. But again, the first thing to do is try to resist the urges, have alternatives to those urges, and identify the fact that you do have an issue with eating. And you have to learn to empower yourself by making um, good quality choices. So really, what happens when your body consumes addictive foods? So when you ingest things like sugars, flours, grains, really you have this part of your brain that is called the reward circuit. And you get these dopamine levels, and your brain initially likes it, and it likes that sugar because your body and your brain especially is dependent on glucose levels. So you get this short-term fix, and your body gives you pleasure from that food. But the problem is this addiction has a dark side to it, because once those levels drop, okay, once your brain gets overstimulated with these dopamine levels, and once it gets to this high point, then there's nowhere to go from being down. So instead of just overstimulating it and hitting your dopamine levels for that short fix, you want to go towards a much more longer um, kind of avoiding the addiction pathway. So instead of flooding high levels of dopamine, you just eat when you're hungry. And you'll find over time your dopamine levels tend to go back to normal, and you're no longer going from high to low, because every high has a low. So you want to have a nice stable plateau where your body is eating for nutrition, and your body's not being flooded with high calories for that short-term fix that has a long-term um, low. And that's the issue with addiction with food. So when you continue to compulsively eat, what happens is the brain does get adjusted to these dopamine levels, and it makes less dopamine. So the next time you eat the same thing, well, you're going to have to eat more, get more calories in, get more sugars in to get that dopamine level from your brain. So really, your body becomes tolerant like it does to everything. If you do the same thing over and over again, well, guess what? Now it takes twice the calories to get that high from your food choices. So really, these long-term poor food choices can lead to compulsive eating issues. And fundamentally, it can change your brain's chemistry, and it can alter your learning, your judgment, your decision making, your stress, your memory, your behavior. And even though people know that eating this food is not only going to be bad for them long term, they're going to feel guilty about it. Well, they have this compulsion to do it because they're stuck in this cycle. So another question is, why do some people become addicted to certain foods while other people really don't? And there's no real one factor that we can use to predict an addiction to certain foods or certain eating behaviors. We think that maybe there is a biological and genetic component under certain circumstances. Um, there are certain cultural things that can come into play, but ultimately there's no set idea that we think we can look at a patient and determine what their chances are to being addicted to foods. We also know, again, um, family, friends, economical status, general quality of life play roles in this. And also, it's important developing good habits early on, because those early habits can continue in your life, whether they're good or bad. So the question is, how can we deal with food addiction, and can it be cured? And like any other addiction, when we talk about a cure, uh, treatment for food addiction isn't a cure, okay? But food addiction is a treatable issue, and it can be managed successfully, or at least controlled. So, like any other addiction, the first rule is to identify, again, this is a problem, this is affecting you, this is affecting your health, and once you identify the problems that you're doing, well, then you can work at managing it. So again, there's so many research studies out there that show that combining abstinence from a person's food addiction with support with different programs such as a 12-step program or support groups or friends and family do help decrease the chances that someone's going to fall back into these patterns of just eating for these temporary highs. And again, every person's treatment or modification of their food addiction is an individual thing, but it does require long-term follow-up and little touches every day. But also, we know that when we work on this with medical um, specialists, when we have mental health providers, when we have great support, it does improve long-term success rate. So again, goal setting and self-monitoring is very important. Something called the Smart Healthy Eating Goals is a great tool to use, and that is being specific, being measurable, being action-oriented, being realistic, and being time-framed. So again, here are some examples of the SMART goal examples. Is if you're trying to eat out less often, so try this goal. I will pack my lunch from home 3 times this week instead of eating at a restaurant. Or if you want to be more organized with meal prep, you say, I will spend an hour on Sunday planning meals for the week and preparing ingredients. And if you're trying to cook and eat more at home, you cook a meal from scratch for dinner this week, and I will do this on a Friday. So again, your goals have to be very specific. And when you plan ahead of time, I tell my patients all the time, you can't be this person that just wakes up and says, hey, now I'm hungry, what am I going to do? Once you plan your meals, once you plan what's going to go into your body, well, you get this control back and you avoid bad habits because you already have a plan to prevent going into a part of your life where you could have been eating for the wrong reasons. So again, nutrition is there for your body. We avoid these highs. We don't want the lows, but planning is so important. Again, we come into the next topic of self-monitoring. So really, it's very empowering for our patients to record their dietary intake and also record their physical activity. So I encourage most of my patients to have a little journal. There's so many apps out there that you can buy where you track what you're doing. Not only can you track your calories, but you can track your progress. So I like setting goals low in the beginning, and I love seeing that progress. The body responds great to that. So if you can't walk for 10 minutes, you walk for 5. You write it down. And once you record your calories, you see progress. You are taking 2,000 calories. The next day, you cut it down to 1,900. Your body's going to be rewarded by those small little achievements, and that's what really sustains things for a long-term improvement. So again, food diaries can be very, very important. Self-monitoring, keeping tabs on yourself are also very important. And there's so many things out there as far as therapists, apps, logs that can really help our patients stay on track. So again, we recommend that you write down most things just to kind of get you started, especially if you're dealing with fighting some food addiction tendencies, such as writing down everything you eat and drink over the day. You might not realize what you're taking in. And also writing down your feelings or your thoughts. Why did you eat a certain way? How were you feeling when you had breakfast? When you had a good day, how did that affect your choices? Again, so having these little journals down are very beneficial when you go back and look at them and you assess your day and also plan your next day. So again, when you write down things like how are you trying to burn calories? You're having any issues of vomiting? Are you doing anything that you shouldn't have? Are you doing something that you should have? And being very specific in these can really help our patients become empowered to figure out where they're at so we can figure out where to go. Again, these logs can be very, very important, and we really recommend that you do them and you refer back to them, and that's a great way of tracking progress. So ultimately, we're here to help. There's many, many options out there for weight loss. A bariatric surgery is definitely an option for many patients, but not for everyone. But we're here to help. And what we want to do is we really work on kind of reinventing ourselves. Okay, so the goal is just start. Once you start, identify your problems. It's very hard for patients to kind of look in the mirror and say, hey, I have a problem with my weight, or I have a problem with food addiction. But once you identify that problem, you start off with small goals, you assess it, you plan, you write things down, and there's great options out there to help with that and food addiction, which is a huge part of what we deal with in obesity medicine. So thank you for watching, and we're going to have a quick test for you guys to do after this, see if we learned anything.